When it comes to prostate cancer, it's very important to have an accurate diagnosis so that we can organize proper treatment for the correct type of disease. Certainly PSA is the most widely used test to screen for prostate cancer. However, it does have its limitations. It certainly can find a lot of disease, but it often can be low-grade disease which does not need to be treated, which leads to overdiagnosis and overtreatment of prostate cancer. A biopsy would be used after an elevated PSA is identified to determine whether the patient in fact has prostate cancer. Certainly biopsies have come a long way. We can do them on an outpatient basis now very conveniently for the patient, but they still are an invasive test and there is a risk of infection with them. And so therefore, if we could come up with another way at some point in the future, that would be desirable.
There's a need for a marker, and that's what we tried to do with our 3D telomere analysis. The first stage of the project involved patients who are intermediate risk, 200 of them, and we were collecting blood samples from the patients. And then we were isolating circulating tumor cells from the blood of the patients and use those cells to perform three-dimensional imaging, 3D imaging, to understand the nuclear architecture of the cells. So it's like a liquid biopsy without doing a biopsy. So you take a blood sample and you can analyze the genome in 3 dimensions of that specific patient and of each individual cell of that patient.
This research could possibly change the way the world tests for prostate cancer.
You will be able to say for each patient at that point in time if the patient is with stable disease and doesn't have to worry, or if the patient is with a more aggressive form of disease, and then I don't think he needs to worry because then we can decide which treatments. But the most important thing is that we choose the right treatment for the right patient and don't treat patients who don't need treatment. The support from Manitoba Right for That was instrumental to get this work off the ground. I think we can be a strong team that involves the patients, the clinicians, and hopefully funding from Right for That.